Hello again, ladies and gentlemen. This will be a talk on something called the student T distribution. This is something that is pretty low yield for the USMLE. I wasn't actually going to talk about it, but I did see it in the some of the mainstream review material like First Aid and Kaplan. So I do want to talk about it briefly. I'm going to try to keep it brief. But as far as biostatistics goes on the USMLE, they're going to probably keep it to the basics. So I would focus more on the normal distribution and not so much on this. But I would know some of the basics about this because there are some very fundamental things about the student T that that do. I mean, they're so easy that it could come up, and we're going to talk about some of those things. So I would focus on the very bare essentials of the student T, and I wouldn't agonize over the details. That's my advice. Okay, so I'm going to try to keep this short. If you haven't had the opportunity yet, please consider subscribing to my Patreon page at www.patreon.com/pwbmd. You can click the link below in the description of the video or on the I button on the upper right hand corner, and it will link you up. If you consider chipping in $1 a month, a little bit goes a long way to help keep these videos free. I really appreciate the help. If you subscribe, you'll have access to some of my premium videos. I go over some case studies, how to formulate differential diagnosis and treatment plan, things that will come in handy for you for future steps and certainly for impressing your attendings. We definitely like to see students and have really good systems of approaching medicine. And so I think that stuff can be really useful for you for clinical practice and for doing well in medical school and your practice in general. So thank you very much in advance for your consideration. All right, so what is the student T distribution? Well, basically, it's very similar to the normal distribution, except you're dealing with small sample sizes. So this guy here, his name's William Seeley Gossett. He worked at the Guinness Brewery in Dublin. He was an English statistician, and he worked with small sample sizes. And what he recognized was that, well, when you have small sample sizes, you don't exactly get a normal curve. You get something that resembles it, but it's not exactly the same thing. And he wanted a way of dealing with these small sample sizes in a more accurate way than using the normal curve, which really was not adequate. And he published his findings and his methods under the pseudonym of student, and so that's why it's called the student T distribution. So the student T distribution is used when you're dealing with small sample sizes, but when you're dealing with small sample sizes, consequently, you're typically not going to know your population standard deviation. Your population standard deviation is something that you know by dealing with really large sample sizes. Either you're dealing with it now or you've dealt with it before. So something like blood pressure. How many times have we taken the blood pressure measurement and recorded it on a patient? Millions, billions of times. So we do blood pressure measurements all the time. So you can collect all that data and you get a real nice normal curve. And so you know your population standard deviation because you've dealt with large populations. Now, on the other hand, if you're dealing with something smaller, let's say the infarct size of somebody who's just had an MI. Well, in that case, you probably don't have a whole lot of data behind it. So instead of having a population standard deviation, you can only get a sample standard deviation. We denote that by S instead of sigma. Now, what's the difference between a population size and a sample size? Where do we make the cutoff? I really don't know, and I'm sure statisticians disagree amongst themselves. I've heard a sample of 200 would make a population, but I'm really honestly not sure about that. So if you're told population standard deviation, use your Z and your normal curve. If you're told a sample standard deviation or you're told population standard deviation is not known, then use your T. So in hypothesis testing, the T value is obtained and it's compared to a critical value which is obtained for a given confidence level. You can get your critical value by knowing your confidence level, but for the T distribution, it's a little bit more complicated than that, and we'll talk about that on the next 2 slides. So remember, to obtain your Z value, which we talked about in previous videos, it's very simple. You just take your sample mean, X bar, subtract your population mean, and then divide that by sigma, or your population standard deviation. On the other hand, if you want to find your t-value, you're working with the student t-distribution, you have a small sample size, then what you're going to do is you're going to take your sample mean, subtract your population mean, and then divide that by this quantity here. And that's your population, or your sample standard deviation, S, divided by the square root of your sample size. Okay? So that is your t-value. And we're going to return to that in a little bit. So notice here that, and this value v here means degrees of freedom, which we're going to talk about in the next slide, I promise. But basically it equates to or approximates your sample size. So it relates to your sample size. And so as you can see here, as your sample size increases, you begin to approximate a normal distribution. The normal distribution is here in black. So as you begin to increase your sample size, you start to obtain a normal distribution. And that's what Mr. Gossett found out as he was working with these small sample sizes. So to find a critical value for your t distribution, you need to know two values, and that is different from the z distribution. Remember, for the z distribution, you only need to know the significance level. So for instance here, if you want to find the critical value for a significance level of 0.05, then all you need to know is that you want to find for 0.05. So find 0.05 on your table. Here it is. It's 0.0505, but close enough. And that corresponds to a z value of negative 1.64. You might even say negative 1.645, which would be right in between 0.0505 and 0.0495. So all you need to know is your alpha, and you can find your critical value. Very easy. For the t-distribution, it's a little bit more complicated. So, of course, you need to know your significance level, alpha, but you also need to know something called degrees of freedom, and that's a new term. We use it in other places in statistics, but we definitely use it in the student t-distribution. Now, I could see the degrees of freedom concept coming up on the USMLE. Why? Because it's so damn easy. All degrees of freedom is it's your sample size minus 1. So if you're dealing with a sample size of 8, what's your degrees of freedom? It's 7. So I could see a question coming up in the USMLE where they tell you sample size 100, what's your degrees of freedom? And if you have never studied this before, you'd have no clue on what it is. You'd be making a guess. But if you know degrees of freedom is just sample size minus 1, you got your degrees of freedom. Very simple. So for that reason, you should know this. So let's say that you want to find your critical value for a t-distribution, for your t-value here. So what you would do is you would find your degrees of freedom that you're dealing with, and then your alpha that you're working with. Let's say that you want an alpha of 0.05, and we'll talk about what these tails mean in a little bit. So let's say you have a one-tail alpha, and you have a sample size of 8, well then your degrees of freedom is 7, and you have a one-tail alpha of 0.05, so your critical value would be 1.8946. So pretty simple there, but you've got a couple things that you need to consider rather than just one. So one-tail or two-tailed? Well, this really depends on how and what you're testing. So if you want to test whether something shows up larger than a critical value and smaller than a critical value, and in that case you use two-tailed. But the important thing is if you want an alpha of 0.05, then on both ends you need to divide your alpha by 2. So it's a little bit different here. Now this is for a z. This is a normal distribution. But it's basically the same concept. So if you're dealing with one-tailed, then your alpha is only going to be the area under the curve on one side. So remember, the area under the curve is equal to your alpha here. So this is your critical value, and then everything more extreme than that is the area under the curve, and that's going to be your alpha value. So here the area under the curve is 0.05. Now if you have two tails, then it's going to be smaller on either side because these two together need to equal your alpha. So you're just taking alpha over 2 because it needs to be symmetrical. So you take alpha over 2, and then you take the area under those two curves, and it should equal your alpha. So here, the area under the curve is 0.05, corresponding to our alpha. And so our z value would be 1 minus alpha. Your t value would be degrees of freedom, and 1 minus alpha. Same for your two-tailed. It's just you're dividing your alpha by 2 since you have two sides, and it's, remember, symmetrical. Now you do the same thing if it were a t curve or a z curve. This is just your normal curve here. All right. This is really not high yield for the test. And there are other people on YouTube that go into way more greater detail on biostatistics. If you're really interested, you can watch their videos, but I try to keep it in the realm of pertinence for the USMLE. So we typically denote t by t subscript degrees of freedom, which would be an integer, and then 1 minus alpha. Or 1 minus alpha over 2, depending on whether you're dealing with one tail or two tail. So let's say you have one tail. You're dealing with one tail. If you have an alpha of 0.05, then you're going to be here. So one tail alpha of 0.05. And let's say you have a sample size of 15. How many degrees of freedom do you have? 14 degrees of freedom. And so your critical value for a sample size of 15, where you have an alpha of 0.05, would be 1.7613. And we would denote this by t subscript 14.05. Sometimes they flip these, but this is how I learned it. Now, remember, we can do confidence intervals with the normal distribution. We can also do confidence intervals with the t-distribution. It's really the same sort of formula. So the confidence interval for the student t is the the sample mean plus or minus the t value for the sample times s over the square root of n. So let's say that you want a 95% confidence interval. If you want a 95% confidence interval, then what's your alpha going to be set to? Well, 0.05, because you want 95%. So you want this value in the parentheses to be 0.95 so that you get 95%. So what you would do then is you would find your t value for your appropriate degrees of freedom, which would depend on your sample size, and then 1 minus alpha over 2. And this would be 0.975, okay, because alpha is 0.05 divided by 2 is 0.025, and 1 minus that would be 0.975. And so with that, if you know your sample mean, and then you can figure out what your t value is, then you know your s, you know your square root of n, and you can construct your confidence interval with that. And typically we do the 95% confidence interval. We don't do anything other than that, and I can't imagine anything other than that coming up on the test, if it does come up at all. So let's try an example here, and we'll leave it at this then. So 10 babies were born in an urban hospital and their weights were recorded. Construct a 95% confidence interval, two-tailed, for weights based on this sample. And this is just a hint that it's going to be, the confidence interval will be two-tailed. So you can do this by hand. You'll never get a question like this on the USMLE because it'll take too long. But this is good for making sure that you understand what the student t-distribution is. And you would go about this very similarly to how you go about constructing a confidence interval for a normal distribution. All right, so I'll let you pause it if you want, and you can equate all your relevant values. Okay, so let's talk about how you do this. So the first thing you want to do, since this is your formula here, you need to find all these values, and you can find all these values by using these numbers and by looking at a t-table. And I would suggest looking up a t-table online. I should have put one on here for you, but you can find them. Okay, so your first step is to remember your formula, and remember that first element of the formula was x bar. Well, that's your population, or your sample mean. So your sample mean is just the mean of these values. Add these all up, divide by your total of 10, and you get 116.9. There's your x bar, pretty simple. What about your standard deviation? Well, you remember how to do that. You take the differences, square them, and then divide them by n minus 1. So that's going to be 470.8. That's your variance. To find the standard deviation, you take the square root of that, and that's going to be 21.7. So now you know x bar, and you know s, and you also know n because n is 10. That's your sample size. So now all you need to know is t. So also you know your degrees of freedom. That's going to be important for knowing t. So you got x bar, you got s, you've got n, you need to know t. And so in order to find t, you remember what you need to know. You need to know your alpha, and you need to know your degrees of freedom. So what's your alpha? Well, your alpha here is going to be 0.05. Why? Because you're constructing a 95% confidence interval. And so your confidence interval is 100 times 1 minus alpha. So that's going to be a 0.05 alpha. So alpha is 0.05 for a 95% confidence interval. And then your degrees of freedom is 9 because your sample size was 10. So you have t, 10, and 0.05. So you can find that by looking up on your t table here. So degrees of freedom is 9. Oops, go back here. Degrees of freedom is 9. And you're dealing with an alpha of 0.05, and because this is you're doing a confidence interval, you are going to divide that by 2 because it's going to be on both sides. So that would be this value here, 2.262. All right, so that's this value here. I don't know why I put 2.261 here. That's weird. Okay, it's not going to impact your result too much. All right, so plugging everything in, 116.9 plus or minus 2.261 or 2.262 times S, which is 21.7, divided by the square root of the sample size, or 10, and you get 116.9 plus or minus 15.5, and that gives you a confidence interval of 103.4 and 132.4. Now, question, if the population mean is 119, is this sample reflective of the population, or is it significantly different from the population? And the answer is, since the mean falls within the confidence interval, even though it's not exactly the sample mean, that we would say that this sample is reflective of the population. If your confidence interval did not include the population mean, then you would say that this sample was significantly different from the population at large. So I hope that this cleared any questions you had up about the student t-distribution. I really only went over some of the fundamentals. I would not worry for the USMLE about a t-table. What I would know is why you use the student t-distribution, and that is for small samples, that it's very similar to the normal distribution, but you use it when you don't know your population standard deviation, when you're working with small samples, and I would know what those degrees of freedom mean. I would also know what the confidence interval is, and this here, how you know when a sample is reflective of a population, and that is when the confidence interval does not include the mean of the population. And I go over that in previous videos in greater detail. So this is just a slide recapping things. As I said, what I would really stick to remembering is when you use either of these. So your normal distribution is used when your population standard deviation is known. Student t is used when it's not known, and instead you're using your sample standard deviation. Your critical values will just depend on what kind of test you're using, whether you're using one-tailed or two-tailed, whether it's going to be on the left, or whether you want your alpha to be on the left or the right. But we already talked about that. Your test statistic is going to be for normal distribution, simply x bar minus mu over sigma. For student t, it's x bar minus mu over S over the square root of n. Remember, your sample size is important when you're talking about the t-distribution. And the confidence interval, very similar formula on both ends here for normal distribution and for student t-distribution. It's very similar formula. I would remember the confidence interval for the normal distribution because that's the one that the USMLE is probably going to test you on. I can't imagine they're going to get that much into the student t-distribution. What I would really know for the student t-distribution is when you use it and what degrees of freedom is. That's really all you need to know for the USMLE. And with that, if you have any questions, please write me a note below. Otherwise, I will see you next time.